Hello, I'm Dr. Indranil and I'm a consultant joint replacement surgeon. A few times ago, I made a video about several things in joint replacement surgery in Bengali. Many people told me to make the same video in other language, so I'm trying to do that. Actually, in that video, I tried to answer three questions which commonly being asked by the patient. Sometimes they do, sometimes they don't. Uh, but these are the questions that need to be answered before this kind of surgery. The first questions that springs to mind to the patient is whether it is a successful surgery or not. Whether I will be able to stand after the surgery, I'll be able to lead a normal life. That is the main concern of the patient. To answer this question, I would like to say that knee replacement surgery is more than 90% successful surgery. By the world literature, wherever you see, it is more than 90% is successful for 15 years term. So in case you are doing this surgery, there is 90% chance you will be beneficial, you will get the benefit of the surgery rather than you will fall into the 10%. Actually, the knee replacement surgery is being done to relieve the pain as well as give you the mobility. So these two benefits gives the patients a new lease of life, which is not possible without the surgery. Another question that comes that can you tell me, the doctor, in which hospital I can get this done? Now the thing is, this surgery is so common nowadays, it can be done anywhere in the world. So I would suggest you to select a center which has multidisciplinary team, which means the hospital has different specialties apart from orthopedics where these surgeries can be done. Whenever a patient comes to a hospital and gets admitted, the patient doesn't come only for the orthopedic problem. Usually the patients also have some other problems which might create trouble during the surgery or post-operative period. So if we have a hospital where the multidisciplinary team is working along with the orthopedic surgeon, that will be much more beneficial for you. To give you an example, if you have a heart disease and you want to do knee replacement surgery, being a cardiology department is a must in the hospital, without which you might land up into trouble during the operation. Another thing which is important about the hospital is the cleanliness, because one of the worst things that can happen to you is post-operative period you have infection. So if the hospital is clean, the operation theater is clean, then there is a less chance that you will be infected by the bugs. Cleanliness also means everything is being regularized, and also you will be taken care of in a much better way rather than in an unhealthy environment. The final question that comes is how to choose my doctor. Now, it is very easy to answer because many doctors nowadays are quite capable enough to do this surgery. So anybody who has done a proper training in this field, which means the knee replacement surgery or hip replacement surgery, any form of joint replacement surgery, they can do this surgery. Choosing a doctor won't be a much difficult task. So you don't have to go far away places from your home to get a doctor. You can be able to find a doctor who is near to you to do this surgery. One more thing is important about the doctor. The doctor listens you very well and give you all the answers that comes in your mind. Other than that, but many things if not being answered, which means that can create a trouble afterwards. So if your doctor is friendly and giving you the time to listen to you and give you all the answers that you need, most probably that doctor will listen to you when you are in trouble. Finally, everything being said, I would like to tell you that if you have now decided about going this surgery, you have to do certain other things apart from this. That means you have to listen to your physiotherapist as well. So while you are going for the surgery, select your physiotherapist who will take care of you after the operation and get you a normal life. I hope this video will be helpful for you to choose your doctor, your hospital, and whether you need this surgery or not. Thank you very much for your time.